The new Johnson & Johnson vaccine could be in the arms of some Americans as early as today. Trucks carrying the single-dose shot began rolling out Monday. FedEx and UPS are working to help ship the doses nationwide. The drug maker made nearly 4 million doses for initial shipment, but the White House revealed Monday the company is pushing to get about 20 million more doses delivered by the end of March. So for more on this, let's bring in Dr. Dyan Hes. She's the founder of Gramercy Pediatrics. So, doctor, how is the Johnson & Johnson vaccine being distributed? We were talking a little earlier with one of our correspondents about, the unique nature of this vaccine by comparison to the other ones, that it's a single dose. So it's kind of ideal for members of the population that are unlikely to show up to a second appointment, like perhaps people who are members of the homeless population.
Well, I don't know much about the rollout, aside from the fact that McKesson, which is a large distributor, is helping implement and set the rollout. But when I was reading the articles, I couldn't tell if this Johnson & Johnson is going to go to the New York City Department of Health, or is it going to go to CVS and Walgreens for distribution. I guess that is TBD, to be determined. But somebody knows where the vaccines are going. But I couldn't find it from the articles I read. But this is, yes, it's one vaccine. It doesn't have to be stored at very low temperatures like the Pfizer vaccine. It's a regular vaccine in a regular freezer, or refrigerator. So it's going to be much easier for them to roll it out. And also, just the logistics of scheduling two vaccines. I don't know if you've helped any people try to get the vaccine. It's like, I call it the Hunger Games. You have to scramble to try to get a vaccine. You have three websites open, and you're hitting enter, enter, enter over and over. And that's only guaranteeing you maybe a spot for the first vaccine. And then you have to do the whole same thing to try to get a second vaccine a lot of the times, especially with, we've had very unfortunate circumstances, like the snowstorms and things that set a lot of other policies back. So this is going to be much, much easier to implement.
I get we're all human beings, and everybody is sick of the situation that we've all found ourselves in over the past year. But, patience. I mean, it's not like if you get the vaccine today, you can all of a sudden start going out and going to the gym and coughing on people. I mean, you still have to, be at home. You still have to socially distance. So, I mean, I know that, Anne-Marie and I have always talked about, we can't wait till we get the vaccine. But, I just think that, there are people who really need it, people who have comorbidities, people who are frontline workers, people who are, professional, teachers. And when it's our turn, it'll be our turn. And that's the way I think, people should think about this. Because, as Dr. Hes, the White House on Monday said setting up the vaccination appointment is still remaining, it's difficult in a lot of places. So I know you're not, you don't know a whole lot about logistics, but I mean, what would you say here in New York City? Emery and I were, I showed her a picture of the Javits Center last week, or maybe it was 2 weeks ago, where there were vaccines available, but there were not a lot of people there. So what's going on?
The technology is not centralized, so it's very fragmented. So if you're in New York City, you could only register in New York City. If you're in Queens, now they're trying, because it was so limited access for people in other boroughs, they're trying to set up centers that you can only get it in Queens or in Bronx, and you have to live there. But you could be one zip code away, show up thinking that you're getting the vaccine, and you're not getting the vaccine. They turn you away now because your zip code is one number off. Whereas I believe that if you show up for a vaccine and you're over age 65, you should be getting that vaccine. I don't give a damn, honestly, where you live, because the more people that are vaccinated, the better it is for us. And they're ultimately going to get that vaccine. It's not like you're stealing from somebody. We're all paying taxes. We're all American citizens. 65 and up deserve the vaccine. Like you said, people with comorbidities deserve the vaccine. I don't believe anybody who qualifies should be turned away. But we don't have a socialized medicine system. We don't have a unified healthcare system. And it is, I have to tell you, I know two physicians who've set up a system called Dos Amigos, DOSE. And it's, if you know people who are having trouble getting the vaccine, these two doctors have dedicated their time to sit with multiple computers and browsers open to try to get these eligible people vaccines. This should never happen in the United States of America. Everybody should be entitled to get a vaccine who qualifies.
So true. Doctor, I want to ask you about some of the latest research on this virus. There's a new study out of Britain that shows that one dose of the AstraZeneca vaccine substantially reduces the risk of older people becoming sick with the virus. What can you tell us about the study?
So it wasn't that we did not think that the AstraZeneca vaccine was effective. It was that AstraZeneca didn't enroll enough elderly people in their study to prove in their data, in a peer-reviewed article, that it worked in preventing COVID or serious disease in elderly. So it was a gamble for the UK to try it, whereas France didn't buy as many AstraZeneca and to give it to the elderly because they were afraid it wouldn't work. But now the UK has shown that it is, I think it reduced infection in 60% the first time and up to 80% the second time. So they are going to start purchasing more of the AstraZeneca vaccine. And this still is only anecdotal. It hasn't been published yet in a peer-reviewed journal.
And there's new data, Doctor, that found COVID-19 infection rates among staff and students at several schools in the UK were lower than in the community. The data also supports the country's decision to prioritize vaccinations by profession rather than age, which is really interesting. So how does this also support the push to get teachers vaccinated?
Well, I think what I read in the article was that in the UK, so 15% of the teachers had it at the same time when they checked other kind of employees and workers in other fields. It was 18%. It wasn't a huge difference. So I think what that article, my takeaway was is that actually that it shouldn't be prioritized only to teachers. It should be prioritized to all different professions who are working in essential jobs.
All right. Dr. Dyan Hes, as always, thank you so much. We appreciate it.
Great. Thank you.